In this tutorial, we will look at the following. What is duty of candour? What the aim of the regulation is, its background and requirements within this regulation. So what is duty of candour? The duty of candour is a legal duty on a hospital, community and mental health trusts to inform and apologise to patients if there have been mistakes in their care that have led to significant harm. The duty of candour aims to help patients receive accurate, truthful information from health providers. So what is the aim of this Regulation 20? The aim of this regulation is to ensure that providers are open and transparent with people who use their services. It also sets out some specific requirements that providers must follow when things go wrong with care and treatment, including informing people about the incident, providing reasonable support, providing truthful information, and an apology. Providers must promote a culture that encourages candour, openness, and honesty at all levels. This should be an integral part of a culture of safety that supports organisational and personal learning. There should also be a commitment to being open and transparent at board level or its equivalent, such as a governing body. The background to the duty of candour comes from the introduction of Regulation 20, which is a direct response to Recommendation 181 of the Francis Inquiry Report into Mid Staffordshire NHS Foundation Trust, which recommended that a statutory duty of candour be introduced for health and care providers. In interpreting the regulation on the duty of candour, the CQC used the definitions of openness, transparency and candour which were used by Robert Francis in his report. What do we mean by openness? It is enabling concerns and complaints to be raised freely without fear. What do we mean by transparency? That is allowing information about the truth about performance and outcomes to be shared with staff, patients, the public and regulators. Candour is that any patient harmed by the provision of a healthcare service is informed of the fact and an appropriate remedy is offered to them, regardless of whether a complaint has been made or a question asked about it. There are certain requirements that we have to fulfil as part of duty of candour. To meet the requirements of Regulation 20, a registered provider has to make sure it acts in an open and transparent way with relevant persons in relation to care and treatment provided to people who use services in carrying on a regulated activity. They also have to ensure that they tell the relevant person as soon as reasonably practical after becoming aware that a notifiable safety incident has occurred. They should also be able to provide support to them in relation to the incident, including when giving the notification. They should provide an account of the incident which, to the best of the provider's knowledge, is true of all of the facts the body knows about the incident as at the date of the notification. They also have a responsibility to advise the relevant person what further inquiries the provider believes are appropriate. An essential part is also to offer an apology. Follow up the apology by giving the same information in writing and providing an update on any further inquiries. It is essential that a good written record of all relevant communication with relevant persons is kept following any duty of candour submission.